Hello and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is April Austin with the Senior Center. Welcome, April.
Thank you for having us back again.
I feel like it's been a while.
It has been a while.
But it's not been because you haven't had activities going on.
No, it's been because we've had too many activities going on. So we have been very, very busy.
And you're going to continue to be busy.
We are. We're open and we're having in-person activities. We're having virtual activities. We've got new programs. We're bringing back the old programs. So we're back. We're fully open, and it is really, really busy.
And your exercise programs, let's start there.
So that's our most popular thing, so it's a good place to start. We are doing all of our exercise classes are back and going. We've got cardio, strength training, chair aerobics, balance, line dance, tai chi, yoga, our fitness room. Our fitness room is pretty much newly refurbished. We had a few pieces that we added while we were closed during COVID. We added some new treadmills and some new bikes. And then just a couple of months ago, we added a new weight machine. So everything in there is pretty much new. I think we only have one piece of old equipment that's left over from the last couple of years. So brand new equipment, and it's there free to use. So we're really excited. We've got everything back. Our beginner basic line dance is going to start in September. So we're going to have all of our line dance classes back. We've got 2 of them meeting right now, and we're getting ready to add that 3rd one at the 1st of September. So we are there for you to exercise. We have exercise opportunities of one kind or another every day. Every day.
Every day. Let's go back to your fitness room now. Do people have to make reservations to use it, or is it just drop
It is
in?
wide open.
Okay.
So they can come anytime we're open, from 8 o'clock in the morning till 4 in the afternoon, Monday through Wednesday. Thursdays, it's actually open till 7. You can come if you're working and you want to come after work. It is a small room, so there's not a lot of equipment, but we've got 2 treadmills, 3 bikes, and the weight machine, so it's all there for people to use at their convenience, so you can come at any point to use that.
And for people who maybe can't get out to come to the Senior Center, you're doing virtual fitness.
We are. We're still doing, our virtual fitness programs are some of our most popular virtual programs. We've got some success doing those, so they're on Zoom. We are using Zoom still. It seems to be the easiest platform for people to use. We're able to get you the links to those, but we're actually doing all of our exercise classes except for line dance on Zoom. So you have the option of doing it either way. So you can do Tai Chi, you can do yoga, you can do cardio. All of those things are offered both ways, so in person and on Zoom. We have some people that are doing both. Some people will come to the Senior Center on Monday, and on Friday they do it on Zoom because they don't want to drive back into town. Or some people, maybe they just don't feel like getting up and getting ready to go, so they do it, at home on Zoom. Don't have to turn your camera on if you don't want to. The other good thing is that if you want to try Zoom and you don't know how to use it, we'll set you up. We'll help you with your iPad, your phone, your laptop, whatever that is. We can get you set up and teach you how to get on there. It's really only a couple steps, so it's pretty easy to learn to use.
And I'm just thinking for myself, when I see yoga, I would like to try yoga, but I don't know if I'm ready to go to a yoga class. So you can virtual yoga may be the way for me to go.
From the comfort of your own home, you can do it. You can, like I said, don't feel like brushing your hair that day, turn the camera off. You don't have to have it on, so nobody will even know.
It's a very good thing. And being fully open means all of your regularly scheduled activities are back.
Everything is back. Our knitters and crocheters, oil painting, crafters, wood carving, cribbage, euchre. There's so many I can't remember them all. We've got a coloring club that meets monthly. Our fun and friendship club that meets weekly. They play bridge and hand and foot. Our computer lab is open. Again, the fitness room is open. Our billiards table is open. So everything's back. And right now, there really aren't reservations for most of those regularly scheduled activities. The only thing we still need people to sign up for are some of the special events. And that's really because, bingo fills up. And some of the other programs, if there is food provided or if there are materials provided, we want to make sure that we have enough for the people who are signed up without wasting a lot of paper or a lot of supplies. So we do ask people to register for some things, but those regular activities, you just come and participate.
Just show up and see what you can learn. You are still doing your caregiver support group.
We are. One of the things, there's been a lot of studies done and a lot of things. One of the things in this region that people say that the county doesn't have enough of is support for caregivers. And we are working, we partner with a number of different agencies, Via Health, Amorum, the formerly Caldwell Hospice. I'm still trying to get used to saying that correctly. The Area Agency on Aging, and different people come together, and we formed this caregiver support group in an effort to try to do that, to give support to caregivers. And we have programs that we do, and then just time for people to talk to other caregivers and get together. We've been doing that virtually for a really long time now. On the first Wednesday of every month, and our September 1st one will be in person, but in October we will actually, our September 1st one will be virtual, and in October we will return to in person. So we're going to be doing those again at the Senior Center for people to come, and just to give you that support, to offer, the programs cover different resources that are available in the county, things that you might not be aware of. One of the things we find, caregivers, there are resources for caregivers, but caregivers don't know where to go to get those. Mm-hmm. And so we really try to focus on things that will benefit caregivers of all different types of people, because our support group is not specific to one illness. There are dementia support groups, Alzheimer's support groups. We are caregiver support. So it doesn't really matter what type of caregiver you are. We want to try to help with that and offer a lot of those resources, and then just give you a chance to link with people who are in similar situations, and just to have a place for you to feel like you've got somebody that understands and supports. So we're going to be doing those starting in October. They'll come back to being in person.
So a very, very vital resource for our community. Yes. And I don't think for a person who's never been a caregiver, they may not understand the importance of that. And I think we also have people who don't even really consider themselves caregivers. I'm just helping mom out. I'm just helping dad out.
And I think that is true. People, that are, I just go get the groceries, or I just pay the bills, or they don't realize that you are caregiving. There are so many different levels of caregivers, and it can be stressful no matter what that is, because a lot of times those people who are just taking people to the doctor, or just going to the grocery store, or just paying bills, are also working full-time and taking care of their children. And that load is something that people sometimes you don't even realize how stressful it is for you until you've been in it for a while. And then you realize, this is a juggle, and you're having to juggle your family and your kids and your parents and whatever that situation is. And I think our lives are so busy that you just sort of start running at full speed and doing all these things, and then eventually that starts to catch up with you. And there's help out there, and that's the thing that we want to make sure people realize is there's help for caregivers, and we want to try to get you linked to that. And we can do that through the caregiver support group, but also just through the Senior Center as a whole. If you have questions about services or programs, we're always there to answer those.
And another service you offer is a Zoom chat. I love this.
This has really been a lot of fun. We started, during COVID, just trying to do things to give people something to do, because we were all stuck at home, and some of us were working from home, and people just needed something fun to do. And that's what this is for. It's just fun. It's not really anything necessarily real serious, especially if y'all know us. We're not always real serious. So we were doing it weekly, but since we're back open and doing some things in person on Fridays too, we decided we would kind of change that to once a month. And August 13th is Friday the 13th. So we're going to be talking about some superstitions, some things, just some interesting facts and tidbits that you might find. It's just fun. It's just something we can do to have a good time, talk about that. And we love hearing, what we expect to hear from people are some of their superstitions, things that they know about. I find that superstitions a lot of times are regional. Mm-hmm. People have those things so if you're not from the area that we're from, you might know some things that we want to learn about too. So
I imagine this will be quite a lively conversation.
I expect it to be a very lively conversation.
I may want to get the link and just listen in, because I feel like I could learn a lot.
That's what we're hoping for. So, and like I said, just something to do for fun, something that we can just, we like things that are kind of lighthearted. We don't have enough of that going on right now. So we try to add some things that are just out there for people to do for fun.
And the next one's not necessarily fun, but it's very, very important.
Back to our serious side. We do have a serious side. And that's advanced care planning. And one of the things that we have been unable to do at the same level during COVID is our advanced care planning. We still did it. We've had virtual advanced care planning workshops with formerly Caldwell Hospice, now Amorum. This is actually going to be our first one that we do since they have become Amorum,
right.
And changed that name. So if you see that printed, please know that it's still the same program, just a different look and a different name. But we're going to be doing that in person. Starting August the 12th, they are going to be back in person. So we'll have notaries on hand. We'll review those healthcare power of attorney documents, living will documents. You have a chance to ask any questions, go through them, and then you have the option to complete them that day and have them notarized. Or if you want to think about them and take them home, then you can set up an appointment for a notary to do that for you. But it's a free program. If it's something that we are able to offer for free, that you don't have to pay an attorney to do, so it's definitely a cost savings for people. And really important documents, because once you need a healthcare power of attorney or a living will, it's usually too late to fill one out. And so we want you to think about those things ahead of time and have them. They're really a gift to your family, to have your wishes kind of down on paper and have those things ready for people. And you never know when you might need them, even for a short period of time. If you're hospitalized or if you're sick or if you have surgery, you need to have those documents in place. So if someone needs to make a decision while you're under anesthesia or while you're recovering from an injury, they're able to do that for you.
A very, very important thing to think about. Talk about with your family.
Mm-hmm. And also, it's really, it's been something we've missed doing in person, because there are a lot of people who don't have access to do it through Zoom, and we know that, so we want to make sure we're able to get those people. So this is something that would be a really good idea to call and register for, because it may fill up, because it's the first one we've done in person, so it may get full. But we are going to be back to doing them every month, so if you can't get in for August, there'll be one in September and October. They'll just keep going. So.
And again, back to the fun side of things, bingo.
Yes.
And you're doing so much with bingo that just blows my mind.
Bingo's always fun for people. So we still are working with those people. There's a lot of people who still aren't comfortable coming back to in-person activities, and we completely understand that. There are a lot of people who weren't ever able to come to in-person activities, and we realize that too. So we are doing conference call bingo. There is no internet, no computer required. You call in, and that's actually going to be on August the 12th as well. You call in if you want to sign up. You call us. We give you the number to call. We send you bingo cards, and then you use whatever pennies or scraps of paper or anything you want to cover your cards, and you can either pick up your prize or we can mail it to you. So we'll be having some gift cards and a few other things that are prizes for the August the 12th bingo. That one's sponsored by the Senior Center, so we're doing the prizes for that. But again, no computer, no internet required. You can also play bingo on the phone and in person. You can do both if you want. And August 27th, back by unbelievably popular demand, will be Chick-Fil-A Bingo, which has been everyone's favorite as long as I've been with the Senior Center. Everybody loves Chick-Fil-A Bingo because they always have some really good prizes. So that's going to be in person on August 27th at 10 o'clock. So you do need to sign up for that, so we make sure we have enough space for everybody. So lots of fun and prizes for both. You get prizes even if you're on the phone. And we've had some really good bingo games on the phone. It's really a lot of fun. I didn't know how it was going to go to begin with, but people really like it. You're just kind of in there in this conference call. It's almost like you're in the room with everybody. You can talk to the other participants. You can talk to us while we're calling the game. Ingrid is our bingo caller. So for those of you who know Ingrid, you never know what might happen when you play bingo. But it's been a lot of fun. We've really enjoyed being able to do that. So we hope people will join us. It's not too late. We can get you the bingo cards as soon as if you can pick them up, even as soon as right before. So we can have those for you in just a couple minutes. We can mail them to you. You can pick them up. You can have a family member pick them up. So there's lots of options for that.
Lots of options, lots of ways to play bingo at the Senior Center and win prizes. So and
it's really a good thing for people who maybe aren't ready to come back out in crowds of people, because bingo is usually kind of crowded. So we are putting all the safety precautions in place and trying to keep people distanced and make sure that everything is cleaned and sanitized and those sort of things. But some people with this current surge in COVID cases are not real comfortable coming out, and we want people to have opportunities to participate in multiple ways. So this is a good way for you, even if you don't have the computer, you don't have internet. If you have a phone, whether it's a landline or cell phone, you don't need long distance. It's a local call, so you can call in. It is not, though, the senior center number. So you need to call us to get that number to call in for bingo.
Right, see that call it phone bingo,
Yeah.
you need to register.
You do need to register just so you get the right phone number to call in.
So, and that would be a great thing for people who maybe are shut in, not just because of COVID, but because of limited mobility.
Yes, absolutely. People, we have people play that just don't have transportation during the day. We have people who, just don't want to come out. Some people are playing that just think it's too far to drive to the senior center all the time, so they want to play from home. You could play, anywhere you've got a phone. We've had people play while they were on vacation. People can call in from wherever you're at play. So it's a lot of fun. So we highly recommend giving it a try if you haven't done it.
And now we have something again. We're back to a little more serious.
We're just going back and forth
We
today.
are just going
that
back
was
and
not planned.
April provides me with a great outline, but today we're back to something a little more serious, Medicare 101.
Yeah, so Medicare 101 is something we had been doing virtually, and some people aren't able to participate in that, so we have started those back in person. Again, we're size limiting that to keep people safe. So. But we're going to be doing our next one on August the 16th at 5:30. So we scheduled some of those in the evening. So if you're still working, you can get to that. And that's a good class for people who are new to Medicare or who are going to be turning 65 sometime in the next year, to give you an overview of what you need to do, when you need to do it, how to make sure you don't miss any important deadlines, that you get set up for everything you need. We kind of walk through it. You'll get a whole packet of information that you can take with you. And then once you, we recommend that class to most anybody who's new. You can take it even if you're not new, if you've been on Medicare a while and just want to know a little more about how it works. But we recommend people take it. I have some people who take it 2 or 3 times just to make sure they understand everything before they have to sign up. And then you'll get the information in the class on how to set up a one-on-one session to go over your detailed information and make sure that you're on all the right plans and that counseling service that we offer. This is just sort of a good overview for that. So we do that counseling all the time. We have multiple options for counseling now, so if you don't want to come in or you don't feel safe coming in, you can do counseling over the phone, you can do counseling over Zoom, you can do counseling in person, you can do counseling in the parking lot. We've done all of those things, and we'll continue to do that. We do have someone that's available almost every day of the week who can help you with your Medicare things. If you just have a question, a lot of times you can just stop by, but if you need that one-on-one specific signing up for a plan or making changes, we recommend that you have an appointment just to make sure somebody is there, because there's occasionally not. We still do the extra help applications. So if you think you're paying too much and maybe you qualify for some assistance with that or some reduction in your copays and premiums, we do those. Again, over the phone, in person, over Zoom, we can do all of those things. And most importantly, we are getting ready in September to start making appointments for Medicare open enrollment. And we want to talk about that early because the last 2 years we have completely filled all of our slots for counseling sessions during open enrollment. So we want people to get in early and get the information back to us and get those appointments set. So starting September the 1st, you can pick up the purple forms. Everybody that's been with us before knows we have a purple form, and it's just got some basic information and a list of your medications on it. That's kind of what we need to get started. And you can pick those up, turn them in, and we'll start scheduling appointments in September.
And appointments take place when?
Open enrollment is October the 15th through December the 7th. Depending on how updated and accurate everything is, we don't always do appointments on the 15th because sometimes that first day things don't work quite right. We start working on the 15th. That's as soon as we can do anything. But a lot of times we don't do any enrollments till a day or two later just to make sure that it's right, because the one thing we want to do is make sure we are giving you the best information possible. And the system that we use through the Medicare Plan Finder system is nationwide. It is everybody in the entire country, the same dates, and it usually that first day has a little bit of problem just because there's so many people coming on, so many people using it, and we like to make sure everything's accurate. So, but we will, if you can get those forms back into us, we will get you seen and get you scheduled. And you can actually start picking up the forms anytime. The forms are there. We just won't start scheduling the appointments until the 1st. So if you bring it back in August, they're just going to tell you, we'll call you, because we're not scheduling those appointments to the 1st, because we're working with our volunteers right now to finalize their schedules and when we'll be able to do all of those. We do have some new options this year too, because we are open late now. So there are a lot of people out there who have Medicare and are still working. So if you need an appointment late, we do have some time after hours that we're going to be able to do some appointments. That's something we've never been able to offer before. So we're excited about having those Thursday night hours. So if you need to come, after 5 o'clock, we've got some time we can get that done for you too.
And I think it's always important when we're talking about the Medicare enrollment and updates, your SHIP counselors are volunteers.
They are, yes.
These people are not paid by any insurance company. They are
not. We so in the way that works now, our senior center staff are also SHIP counselors, but they are not. We are not paid to provide the Medicare counseling. We receive a grant to provide the SHIP counseling. And for those of you who don't know, SHIP is Senior Health Insurance Information Program, and it's through the Department of Insurance. So our volunteers are trained. They do an online training, and then they have ongoing training that's provided through the program, through the Department of Insurance in North Carolina. And they work during the whole year to do this. They have to provide a certain number of volunteer hours. And even our staff who are paid as senior center staff have to provide volunteer hours for the SHIP program. So, we're doing those things outside, but we don't get paid based on what plan you choose. We don't get paid on any of that. We just get a grant, and we try to serve as many people as we can in Caldwell County. And we want to make sure that people are getting the best plan to meet their needs. That's really all we're doing. We just want to provide you that unbiased information and make sure we're getting you set up the best we can.
Right, so those appointments, you start making appointments September 1st.
Yes.
So that's an important date to remember there.
And the appointments will be in October, November, and early December. So they'll be done before December 7th.
Okay. Now, something else that looks like it's going to be a lot of fun, and food's involved.
Always fun.
Always fun, which adds an element of fun. Tell us about Dessert with the Director.
So this is one of our new ones, or one of our ones that's coming back. We haven't added this back yet till August. So we started this, I don't even remember when we started it, but pre-COVID, we started doing Dessert with the Director, and it's exactly what it sounds like. You come in and you sit with me, and everybody has dessert of some sort. I think we're going to have an ice cream theme for August. So just because it's fitting, and
so it's very
the people
appropriate.
who come to the senior center will understand why when they check out the newest bulletin board, because for people who maybe can't attend at this time, we have an ice cream shop set up that you can write your suggestions on and leave that on an ice cream cone. Ingrid is very creative, so but we want your thoughts, your ideas, your feedback. And we had suggestion boxes at the senior center, and they just don't really get utilized quite the way I would like for them to. So we decided a few years ago that we would start doing this, and we just sit down, and it's a time for you to let us know what you like, what you don't like, what you would like to see happen, programs that maybe you would like to see us offer. They can be one-time programs, they can be ongoing programs, and we've implemented a lot of those ideas. A lot of the programs that we have added have come from those Dessert with the Director meetings, because people, have suggestions, and I'll be the first to say I can't come up with everything. There's no way. So I want to hear from people what they like and what they dislike. It's okay to tell us, I came to this program and this was not okay, because we don't want to reschedule it if it's something that didn't interest people. So it's a good time, and we're kind of shifting gears and starting back up and doing things a little differently than we've done before. So we want to hear back from those people about what they want to keep, what they don't want to keep. Our virtual programs are going to stay, but maybe there's some virtual programs you would like to see that we haven't offered yet, or maybe there's some that we're offering and you're like, we don't like this. So we want to hear all of those things, and this is just a chance for you to offer that feedback and, again, socialize a little bit, have some dessert, and we hope to bring those back every month or so, at least in the future.
Just a fun way to get together, fellowship, and give your feedback.
And give your feedback, yeah. And it's a great time. It's not a judgmental thing for the people who know me well. They know my feelings don't get hurt very easily. So, and I'm okay with people saying, oh, I don't like this program, because we really strive to do things that people want us to do, and to offer programs that meet the needs of as wide a variety of people as we can. And it's difficult. So without the feedback, we may not be making the best choices, and we want to make sure that we are. So
fun. It's educational, but I think it would also be a fun program. The Caldwell Heritage Museum.
So I'm really excited about this program. We have been meeting with Cindy Day, the director for the Heritage Museum, and we've actually kind of worked out a partnership. This is going to be a series. They're going to keep coming, and we're going to have some fun things. Some of them are going to be at the Senior Center. Some of them are going to be at the History Museum. And so we've got some things coming up. But the first two that we're doing are going to be at the Senior Center. So we have one in August, on August 19th at 1, and another one on September 16th at 1. And the first one, we're going to just kind of talk about the history of Davenport School. And so if you don't know much about Davenport, that's a great time to come and learn. And she's going to talk a little bit about how the History Museum came to be, because there's some interesting stories that go along with that, and I don't want to give much away. So we want you to come and do that. And then in September, it's going to be about the history of Caldwell County. And I think people a lot of times don't know the history of Caldwell County and what happened and how this area came to be, and some of the things that are important for you to know. And then we do have some more things scheduled a little further out that we're really excited about, but we're going to keep those under wraps for just a little bit. So, but we would love for people to come out and join us for this program. I think it's going to be very educational, very informational, and a lot of fun. So we've done some history programs in the past, but they're we schedule one and then we find somebody to do it. This one, we're trying to get it into a regular partnership where we have it kind of scheduled monthly, and we have different topics, different areas, things that are going to go on. There's a lot of history in this area, so I think it's going to be something that people will really enjoy.
I think people will really enjoy it and probably learn a whole lot.
Yes, absolutely.
And I'm also picturing with the folks at the Senior Center, there may be some great conversations going on.
I think there will be some good conversation. I think there will be an opportunity for people from the Senior Center to share some historical information from a perspective of being here. And a lot of the people that come to the Senior Center have been here for many, many, many years, and other people have not been here for many years. And I think that's a great dynamic, because one of the things we've done, and people have really expressed an interest in, and we're working is, but they love to talk to each other. So the people who aren't from here love to talk to the people who were from here and hear about the county and the area as they were growing up. Their stories. Our seniors have amazing stories. So many of them have amazing stories. And we did a project with the Caldwell Early College High School where the students interviewed some of our seniors. And just listening to those stories, it was fascinating to me to be able to hear some of those. And so we're actually working on some things where we can share some of those stories with our seniors too. So there's some really good things coming.
Really exciting things. And on this next slide, I had to look twice because I had to make sure I was reading it right. But it's September.
Yes, it is September instead of September. We did this last year, and this was so much fun last year. We challenged people to walk as a way. September's National Senior Center Month, and we wanted to do some special things, and we were still closed, and we couldn't figure out what to do. So we decided to challenge people to walk. We had already done some walking things last year where we had people come into the Senior Center, but we thought, why do they need to come? They can participate in this anywhere, anytime. So what we did last year is we had this big thermometer outside, and we tracked everybody's steps. So you sign up to participate. You let us know you want to participate. And each week you send us your steps. Real simple. You walk, and doesn't matter where you walk, how you walk, if you're at the park, if you're walking your dog, if you're walking inside your house, every step counts. and you're going to win some fabulous prizes. And actually, I really mean good prizes this time. So, we had some prizes last time. We didn't know how many people were going to participate, how well. We had some good prizes. We have great prizes for this one. So we're really excited. We also are going to have a kickoff event on September the 1st from 2 to 3. So everybody who signs up and comes to the kickoff event is going to get a goodie bag and a free pedometer while supplies last. So you do not have to attend the event to participate in the month-long event, but we are having a little special event to kick it off. So you can still participate even if you can't come on the 1st. Last year we set a goal of 3 million steps. We did a lot of research on average steps and how many people signed up and what we should do. We obliterated that goal. We had over 5 million steps last year. So we have upped that significantly this year because we do want it to be a challenge. And here's the best part. You don't get prizes based on necessarily having the most steps. We really want this to be something people enjoy and participate in. So we have all these categories for prizes. You win prizes for turning in your steps on time, the people who turn their steps in. You win prizes for the percentage of improvement. So if last week you walked, 50,000 steps, and the next week you walk 60,000 steps, you get entered in prizes for that. We have just random prizes for people who are participating. So we have a lot of different ways to win other than just having the most steps, because we know everybody's at a different level, and what we want people to focus on is improving your physical activity, not compared to what anyone else is doing, but to kind of focus on you challenging yourself. And so, it may be a challenge for you to walk 8,000 steps a day where somebody else walks 10,000 steps a day, and we don't want that to be the goal. So we're really focused on making sure people win for improving their own abilities, not necessarily comparing them to anybody else, because we don't want to do that. Nobody else knows how many steps you turn in. I keep the track of the record. It goes into a spreadsheet. Nobody else knows. We don't share anybody's individual step results. We only share our total as a group. So we're super excited about this and can't wait to do it. But it's time to go ahead and sign up now. We want to get people signed up, because if we know you're signed up ahead of time, we'll have more goodie bags available than if you sign up at the last minute. So it's really important to let us know you're going to participate. And it's a week-long thing, so you start counting your steps when you get up on Friday morning, and then you turn them in. You count them through Thursday night, and you turn them in to us the next Friday. But we're really lenient. If you forget to turn your steps in one week, you can actually call them in the next week. They still get counted. You might just miss out on one Friday prize, but you still get to count them. So lots of fun. Again, don't have to come to the senior center. You can walk at the senior center. We have quite a few people who come and walk around the parking lot. We have that marked off for you, so we know how long that is, how many laps you have to make to get a mile. Or you can walk with your friends, you can hike, you can walk at the beach. We had somebody last year who participated walking at the beach. They had a place at the beach, and she spent most of the summer there. So she emailed her steps from the beach, and it's going to be a lot of fun. And we'll have a lot of other extra things going as we do. But on September 1st, we will have goodie bags, refreshments, pedometers, lots of giveaways. So we'd love for people to come out and join us for that. Again, though, you don't have to.
And you can, if the weather's not good to walk outside, you also have the fitness room with the treadmills.
Yes,
so.
We have treadmills. You can walk on the treadmills. We have a lot of people who use the track at Quest for Life and walk indoors. All of those things are acceptable. It doesn't matter where you walk or how, just that you walk.
That you walk. And you can stay connected with the Senior Center through social media, and you do a lot on social media.
We do try to do a lot on social media. We've had so much fun with that. Our social media presence has increased through COVID. That's one of the things we've worked on. And we do still do Travel Tuesday. Every week we do Travel Tuesday, and we go to a different destination. As we are filming this, the Olympics are going on, so we went to Japan this week, just for something to give some people some information. And just a little teaser, we're going to have an in-person travel event at the Senior Center too coming up in September. So we'll talk about that next a little bit more, but we're going to be traveling to Thailand with somebody who's got some great information and knowledge, and we're really excited. And like I said, we'll give you some more details on that next month, but keep in mind that we're going to do an in-person. We do Wellness Wednesday that goes out on Facebook and email. We do tips and tricks and exercise videos and things that maybe you just haven't thought about to try to keep people healthy. And we try to look at all aspects of wellness, not necessarily just physical wellness, but we want mental health wellness and spiritual wellness, and we try to cover all those areas. So again, email, Facebook, we send things out on a lot of those. We do some things on Facebook. If you're not following us on Facebook, you might want to, because that's also another chance to win prizes for things. We do some special things and offer, drawings for people who participate. It's just fun sometimes.
It's always fun to see the Senior Center pop up in my news.
Yeah. It's the fastest way to get information, because everything we do gets posted on Facebook before anywhere else. Mainly because nowadays we all walk around with those little contraptions in our hands that give us access to Facebook immediately. So everything goes on Facebook before it goes anywhere else. We do try to put it on our website and send it out in our emails, but those take a little longer. So Facebook is the place to be if you want to know quickly.
That's right. And your hours have changed, and you've mentioned that a couple of times as we've talked today, but tell us again what your hours are.
So Monday through Wednesday, we are open from 8 in the morning to 4 o'clock in the afternoon. On Thursdays, and this is every week, we're open from 8 a.m. to 7 p.m., and we have, the fitness room, all of our things are open till 7, and we also have a Tai Chi class that starts at 5:30 on Thursday nights. That's a Tai Chi and Qigong. It's a great class. We've started to have quite a few people come into that, so it's a really, really good class. And then on Fridays, we're open from 8 to 1. So we close early on Fridays now to be able to offer those evening hours and give people who, you always see a lot of people who work, a lot of people who maybe keep their grandkids during the day for their children to work, different situations. So we wanted to just offer some time outside of that regular 8 to 5 thing for people to be able to come if they wanted to.
Lots and lots and lots of opportunities. Yes. If people need to reach the Senior Center, how do they do that?
They can just come see us. We're on Penton Avenue in Lenoir. If you don't know how to get there, call us. We'll give you directions. I'm not good at that, so we won't do that on television. But we will give you directions. Somebody that's better at it than me will. You can call us, 758-2883. We have somebody there that can help you. We can do most things over the phone, so if you just want to call and get information or help with something, we can do that. You can visit our website, which is caldwellseniorcenter.org. Our newsletters are posted on our website. Our calendars are posted on our website. Some general information. Again, you can follow us on Facebook and get that information. Or if you want to be added to our newsletter mailing list or our newsletter email list, we can add you to those too. We do have several emails that go out each week with reminders, updates, things like that, so we can get you information in many, many ways.
Always a lot going on.
Yes.
Always. April, thank you for joining us.
Thank you.
Thank you for sharing all the things that are going on at the Senior Center. You're always so busy, and I appreciate what you do for our community, the seniors, caregivers, so many groups of people you're reaching.
Thank you, and thank you for helping us get that information out to the community.
And thank you for watching Caldwell County Today.